Today, we are diving into Jubilee's newest video, 1 Psychiatrist and 20 Depressed People, featuring Dr. K from healthygamergg. Now, when I first saw this video, I thought it would be a wild way to set up if it was 1 psychiatrist versus 20 depressed people, which would just lead to all sorts of cognitive dissonance. My other concern when I first saw this video was, how are you going to bank on 20 depressed people all showing up to filming day between the symptoms of low motivation, low mood, low sense of self-worth, maybe irritability? There's a lot of things going on that actually work against all 20 of these people showing up to the day of filming, but I guess they got everybody there. They shot this video. I have not watched any of the conversations yet, so I think we're going to get through about half of it, and we're just going to see what these interactions are like, what kinds of things I pick up on from what Dr. K is doing with his therapeutic approach, and what some of these individuals are sharing throughout this video. As always, please do like and subscribe. That helps the channel to continue to grow, help us make more content like this. Let's dive right into the video.
Are you watching this feeling hopeless or broken? Are you doing all the right things but still feel deeply depressed? I'm John Regalato, and from Jubilee Media, this is Surrounded, featuring 20 people who are struggling with depression. Now, if you've seen the show before, you know it's built around debate. But today we're doing something different. This won't be a debate, and this time the flags won't be used to vote someone out of the circle. They'll signal your desire to speak with our featured guest, psychiatrist Dr. K. Welcome to the show.
Thanks for having me.
Thank you all for being here. We're very appreciative of you guys sharing your stories. Let's get into it.
All right, so the first thing to know is that it's different, right? He said that it's not going to be a debate format, and it's almost going to be a filmed therapy session. Now, right away, my ethical mind goes to, okay, what kinds of releases of information did they sign to be able to be on this show? Because they're going to be asking to be very vulnerable on camera, and Dr. K is going to be taking a step out that therapists are probably not usually comfortable with. But honestly, I think this is great because this is going to be one of the closest that anybody sees to a public demonstration of what a therapeutic conversation can look like, and to be able to say, oh, this is what I want from my therapist. A lot of times it takes place behind closed doors. The idea of how a counselor fits with us is a very foreign concept because we don't know what other counseling might look like. So this is a great opportunity for them to put that on a real platform. It might be like a pseudo therapy because they're just there for 20 minutes having this very open and very public conversation, but you might get a taste of what Dr. K looks like as a therapist himself.
My first surrounded claim is you're not broken, you're overwhelmed.
Levels, you ready to go? Let's have you in the center.
What's your name, ma'am?
I'm Levels.
Okay. Nice to meet you, Levels.
With your claim, I'll say for me personally, I feel like I was broken.
Yeah.
I went through my uncle passing away, and then the next year my grandfather passed away, and I felt like a part of me broke. When he went, a part of me died with him. So
Sure.
when I went through my throes of depression, which I'm still in it, I have my days, my good days, my bad days. I kind of went down that path of like, I lost a part of myself I can't get back. I can't.
Okay, so she's talking about what it sounds like 2 deaths of people significant to her in pretty close succession. She didn't give a particular time frame, but she said her uncle and then her grandfather, I believe it was. And so this is where I think it would be helpful for Dr. K to describe what he really defines broken. He's probably trying to establish the claim that if you are broken, that does not mean there is no fix or that you cannot recover from it. And so I totally get what Levels is saying. When somebody who's very close to you dies or passes away or leaves your life, there is a part of you that feels like they've kind of taken that with them. The part of you that shared life together, that created something that was not just you and not just them, but a combination of the two of you, that part is absolutely broken in the sense of like, it won't be the same again. And so I'm curious how he's going to address that as she continues her story.
I feel that void. I can't fix it. I can't mend it because they're not here anymore.
What did you lose?
I feel like I lost my comfort. I would talk to him about kind of like, hey, Grandpa, I'm sad. Hey, Grandpa, I'm having a hard time at school. Hey, what do you think? And, he's old. He'll go off and have his little conversation about conspiracy theories. I'm like, oh, haha, that's cool. But it's like, it's nice to have somebody in your corner.
What I would notice, and I wouldn't maybe say this to her right away, but I would notice that she hasn't fully healed and recovered from this hurt that she's felt. And I'm not saying that she should have, but she comes in with one demeanor, but as soon as she starts talking about these people that she's lost, particularly her grandpa that she's lost, that was very close to her, who was her main support, it seems like, she starts tearing up right away. And this is obviously a significant person in her life. My approach And again, I don't know how I would do in like a 20-minute time limited recorded conversation, but my approach generally with a client who brings this to me would be first to identify and validate that emotion. You're still hurting over this loss. You're still feeling the pain of this loss. You still feel his absence, that kind of thing. It's interesting that he picked that question to start off with. What did you feel like you lost? I'm also curious to see how he develops that idea.
I mean, I think this is one of those claims that I sort of agree with you already.
Yeah.
When we lose someone, that person's gone forever.
Yeah.
And we're never getting him back.
Yeah.
And it also sounds like he was a really important part of being a safe space for you, someone that you could talk to.
Yeah.
Right? Can you tell me a little bit more about him?
Well, he was a veteran.
Okay, I'm going to be a little nitpicky here. This is not meant to come off as a critique of Dr. K's method. This is just talking about where my mind naturally goes and where our approaches differ. One is not necessarily better than the other. First, I would say for him to make a blanket statement of that person's never coming back, we've lost that forever, I would try to tailor that a little bit, hear a little bit about their religious and spiritual beliefs and background first before I make that kind of statement, because that may not align with how she believes. Now, if she seemed to resonate with that, fine. I got no problem with that. The other piece is a small bit with language, but I've talked about it on this channel before, the can you tell me about. At that point, if you're in a session with somebody, and I know this is kind of a pseudo session, it's not really counseling, at that point, if they really don't want to tell you, they're not going to tell you. So I would say more like, tell me a little bit more about him. So that's just my approach, a little bit of a difference in nuance of language.
And so, there's stuff he didn't really talk to us about, but,
Yeah.
he would take us camping and, bowling. I mean, I was his first grandchild. So all my memories were kind of tied to him, going to his house, having pie, even though pie's not the best thing to have for breakfast, but it was nice,
I think it's a great breakfast.
he would take me places. He would tell me like, oh, this is my favorite food. Let's try it. Let's go do this. Let's do that. It was just nice. Not to say my parents didn't do that. It's just like having somebody outside of, your parents. It
Sure.
was nice to have him.
That little bit of humor, the minimal encouragers, all of those things are ways that he's using to develop rapport with her. And you see that she's talking more readily as she's talking through some of these early memories with him. And those memories are starting to flow a little bit easier as she gets more comfortable talking about her memories with her grandfather and why that relationship was so special to her. Really well done with the rapport building. It took him like all of 2 minutes to get her very comfortable in a very uncomfortable and foreign kind of setting where there are cameras on you, lights, and you are talking about some very deep stuff with a relative stranger and in front of relative strangers.
And when you lost him, what did you lose with him?
I guess my everything. I didn't know how to function. I mean, I have support, but he was kind of like the main like the first person I would go to. And then he died of leukemia. And for me, my family was upset and I was kind of trying to be stronger for them. So I didn't realize how bad it had got. Like I mostly wish I had more time with him. Like I was there for him physically.
Well, it sounds like you were also present for your family when he passed.
Yeah. I didn't let myself mourn. I didn't let myself cry. I was more so like, it's okay, I'll be there for you.
Okay, we'll get into that a little bit. I'm sure he's going to address that as well, because that's a very common dynamic with people who have lost somebody, that they don't let themselves grieve and mourn, and they're looking out for other people. One thing I want to touch on is the body language. He is sitting cross-legged on his chair. I don't know whether that's how he would typically sit during a therapy session or when he's seeing clients or patients, but that is very interesting. And one thing I also noticed from the profile shot, of course, I didn't register this before, but they have a table between them. That's not typical for a therapy session, unless you're doing something with the table with some kind of activity or game or something. But typically you would have that open space between you all, and that creates a more open environment, with the external environment mimicking the social environment, where you don't want there to be barriers between you all. You don't want there to be barriers in your communication. You want that to be direct and open and honest. So I do wonder how much that maybe unconsciously changes the dynamic of the conversation that they're having.
And then when they were done mourning, it kind of got to a point where I was like, maybe I can be upset about this. And it kind of triggered everyone around me. Like, hey, let's not do this right now. Like, I'm trying to relax. I'm like, hey, I'm hurting.
Oh, boy.
But it's also like they
So first
dealt with it.
you chose not to mourn.
Yeah.
And then when you tried to mourn,
They were already
wouldn't.
done mourning. Yeah.
Well, I mean, no wonder you feel broken, because I think you haven't had a chance to heal yet.
No.
Yeah, so he's normalizing what she feels. A lot of times especially with depression, especially with anxiety. It's very common for people to think, I'm the only one that feels this way. So to normalize that and to be able to say, yeah, it makes sense that you would feel that way, that could relieve a huge burden from clients. And yeah, that is not an uncommon dynamic. You're there for everybody, so you're strong. You look like you've got it together when everyone else is falling apart. Then they've kind of picked up and moved on with their lives because that was a really painful time for them. When you start to grieve, when you start to fall apart, and now you feel like you can let the walls down, people don't want to venture back there with you because they felt like they did their time, they did their process. That's one of the dangers for people who kind of shut themselves off during a time of grief, is that you feel very unsupported later on.
Not really, but I put it off to the side, kind of like he's there, and when I get older and my time comes, I'll get to see him again. That's kind of what kind of keeps me going, that, I'm being watched over.
So I think this is also really interesting because you're kind of saying that what you will never get back, right? Because that's what you're kind of thinking is this person who is safe.
Yeah.
And here we are. And when you start mourning, what do the people around you do?
They're kind of off. They're like, hey, let's not talk about it right now.
And I think it sort of makes sense. Like, I know this sounds crazy, but it kind of makes sense, right? Because if you weren't given a chance to mourn, if people didn't make you feel safe, if they didn't take good care of you, and then you, like, literally, like, that's what happened. Well, no wonder you would think that this is the only person that'll do it, because, like, he was the only one that literally did it.
Yeah.
And at the same time, I don't know that that's true forever. Does that kind of make sense?
Yeah, but it's like, I feel like for me it is, because I don't address it.
Okay. So that's his first challenge that he's bringing on. First, he's kind of let her talk, get a sense of what her mindset is. And right now, her mindset that he's evaluating is that Grandpa was the only safe person. There's so much evidence from other family members through this time of mourning and grieving that they aren't safe. And so she feels irreparably broken because her safe space doesn't exist anymore. And so now this is his first challenge. It's a very gentle one, but he's saying, on the other hand, he's introducing another way of looking at things. I don't think this is always going to be the case. And this is one area where I do differ from Dr. K. And again, not in a good or bad way, just different styles, where I don't tend to interject it as my opinion. Now, maybe because he's a psychiatrist, that might hold a little more weight. But I generally want my clients to be able to come up with that other perspective, that other opinion. But my opinion shouldn't weigh that much in terms of changing the landscape of their minds. But if they can introduce, oh, maybe it doesn't always have to be this way, that's powerful. If they can come to that themselves and I can walk with them to that conclusion, that's a very powerful recognition for them. But yes, also he's under a time constraint of 20 minutes, so maybe he's trying to introduce that a little earlier than maybe she would have gotten that herself.
I kind of am like, okay, let's put it in a little box.
Well, that's because that's what the people around you told you to do.
Yeah.
If you can find that safety, maybe if you can advocate for yourself a little bit more. And I know this is tricky, right? Because the whole problem here is that people have not been taking care of you. I think getting some degree of like anger and sort of like letting people know around you like how not okay it is.
Yeah.
That you're hurting and you took care of them and like now it's their turn.
Yeah.
Does that resonate with you at all, or does it send you running for the hills?
Well, it does. I mean, like current issues, my grandma's health, I've been more vocal about being upset versus before where I was like, oh, it's okay. He got to make a choice. We should be happy for him. He can advocate.
And now that you're more vocal, what's happening?
I'm more aggressively vocal. And they're like, okay, like we can't do anything about what she's doing. I'm like, why? I guess I'm being more open about this feeling because it's in the now and not in the past.
That's big. So he's latching onto this exception. She's already made a change for herself. He is building on that point where he's recognizing, okay, she did something different for a reason that's informed by her experience. Now he's really asking her to evaluate and compare. Is this working better for you than the way that you did it with your grandfather?
Yeah, so I'm actually like somewhat optimistic for you. I know it sounds crazy.
How could you? No, I'm messing with you.
Because I think now you're doing something really scary, but very different, which is you are opening yourself up for other people to help you. And the real tragedy of life is when we open ourselves up to be helped by other people. Sometimes they meet us halfway and sometimes they don't.
Yeah.
But I think give people a chance. Yeah, great.
We're going to pause.
This is one thing that, again, because this is a very different kind of setting compared to a normal counseling or therapeutic setting, that I don't know that Dr. K is always this directive. He's telling her, I think you're on the right track, which I agree. I think she is. But normally I let clients evaluate that for themselves. He's suggesting things that she can do. And again, none of these things are wrong or out of line. It's just accelerated more so than I would get to those things. Some of that may speak to his confidence and his experience with his clinical skills, and some of it is also setting as well. So hard for me to say.
Pause here.
Do I shake your hand?
We're going to switch
Sure,
participants now.
Okay.
Sorry.
C, you had your flag up. You ready to go to the center?
Hey, what's your name?
My name's C.
C?
Yeah, C.
Nice to meet you, C.
Nice to meet you. So I'm a former foster kid, and for all my life, I've lived differently from everyone else. Essentially, from surviving, I wasn't taught normal societal behaviors or emotions because I had to take care of myself while being in a dangerous environment. And what's interesting is that even though physically and mentally I'm fine and I feel great and I can do my daily tasks, interact with people, it's still stuck in my body. I feel the depression, like right now, I don't want to cry, but for some reason, my body just wants to let it out. And before, I wouldn't let it because growing up in a Hispanic culture, they'd be like, oh, ¿por qué te lloras? Like, why are you crying? Like, you want to cry? Okay, I'll make you cry. To where it was like, okay, like I can't. But the more that I would hold it in and push it down, the worse it became. Until eventually I just let it out. It's like my nervous system and my mind are completely separate.
Yeah.
And they're going into different things to where my body doesn't recognize that I'm safe. Like now I'm safe. No one is going to hurt me. No one's coming after me. No one is going to physically or emotionally hurt me. But my body is still in that hypervigilant state.
Wow. What a fascinating illustration of trauma. I don't mean to treat these all as like case studies. These are real people with real stories, okay? I don't want to lessen the impact of that. But to really articulate, that's what trauma is. When you know rationally, logically, whatever you want to call it, that you're in a safe space. Nothing's going to hurt you, but your mind and your body cannot let go of the idea that I am under threat, I'm under attack. I need to constantly be on my guard and be ready for someone to hurt me with the expectation that that will actually happen. Now, all this happens at kind of a subconscious level because like they described, their body knows it. Their body is in that hypervigilant state, even when they're trying to relax with their mind. There's a lot that they're hinting at in terms of avoidance, trying to escape from that sensation for the longest time. And then also on the flip side of that, one of the side effects of being in that kind of state, in that kind of hyper-aware, hypervigilant state all the time, is that it's very draining, and that can lead to potentially some of the depression that they're experiencing.
It's always aware. It's always like, okay, there are times where it's just becomes overwhelming. There are times where it looks like disassociation, night terrors, to where it feels like it's hard to trust or connect with people. It feels like I'm still in that like physical state, whereas like mentally I'm great. I just don't know how to. I've gone through the work. I go through depression. I'm taking antidepressants. I'm taking like multiple classes and courses and therapies, but I just want to understand why this happens so much. Why is it that my body reacts so differently from my brain?
So the first thing we're going to talk about is dissociation. You have two parts of your brain, two hemispheres. Your right hemisphere is where we experience emotions. Your left hemisphere is where we're basically logical. I mean, that's not necessarily true, but broadly it's true. Now, here's the really interesting thing. In the middle, there's this part of our brain called the corpus callosum. And the corpus callosum is what lets the right part of our brain talk to the left part of our brain. And when people grow up in a very traumatic environment, that thing stops communicating. You may experience that everything is fine. The left side of your brain, which is active right now, is saying, okay, we're at work, we're maybe like gonna go get some ice cream after work, and you're like living a normal life, but the other half of your brain is screaming.
I did not know that the corpus callosum could kind of shut off by itself. I know trauma has a lot of downstream effects on the body, but I never heard of the direct impact that it would have on the brain like this. But yeah, the physical structure of our brain makes a huge difference, and that's what he's talking about right here.
The problem is the volume has been turned down, so we can't hear it, or the headphones are unplugged. So even though the signal is there, this part of your brain is screaming, the left side of your brain doesn't really feel it, except there are times where it switches over. And then we feel all of these weird emotions, like we feel all these emotions that we had no idea like where this is coming from. Feels really inappropriate because I'm like sitting here having my ice cream and my body is telling me like, oh my God, we're gonna die or something like that, right? So this is a really, really classic situation. I think a big part of this, and the good news is that we can heal from this. What's really hard about this is how confusing it is, because you see like other people react appropriately to the things that happen around them.
And this is a different way of approaching rapport, but Dr. K is absolutely building rapport with C here. Even though he's not doing the same things that he did with Levels, the education about what's going on shows C that Dr. K gets what's going on in their life. And that's a way of establishing that credibility and that rapport as well. Just being able to know what you're talking about. And obviously he's done a lot more research into the neurology of trauma and how that affects the physical systems of the brain. But you see them nodding along and like, yes, he gets it. He knows what he's talking about. He's with me on this.
But literally what's happened is you have all of these pent up reactions that you've been carrying with you. And I can see that this is bringing up. What are you feeling?
I don't know what it is. It's just kind of just what I do is I don't even just let it out. It's as if my body wants to cry, but I'm listening to you and I'm not crying, but my body is.
Yeah.
Really good use of immediacy here. Immediacy is where he interrupted his own thought because he noticed that C was having a reaction of some kind. They started crying, they started tearing up. That immediacy helps us to be mindful instead of just escaping into our thoughts or our logic or our reasoning or saying like, oh, I shouldn't be feeling this way. Tune into that. Pay attention to that. What's going on for me right now? What does this actually feel like? That's a powerful tool that I love to use with my clients. They probably don't love it when I use it with them, but I love using it.
See, it's happening right now. And so when you feel this way, what do you do?
Before it used to be really bad where I would like hit my forearm or hit myself and be like, no, you can't
Also
feel this
common.
way. To where now I've learned that I let it be, let it process. You know, if I'm gonna cry, it's like I even close my eyes and I go, it's okay, you're safe, no one's gonna hurt you. You can just breathe and I just let it out. Because the more I let it out, the more I let it be, then it kind of goes through this like stress cycle and I'm able to like be myself again.
Okay, what C's talking about is completing the stress cycle. And this is really tied in with acceptance and commitment therapy. They said they've been through a bunch of therapies, a bunch of courses, so this probably came up for them. They can accept that their body's having this reaction. They might be uncomfortable with it, they might not like it, but they've learned to accept it instead of rejecting it like they did previously. And so what they're talking about by completing the stress cycle is basically by allowing it to run and then doing some kind of activity, grounding techniques, sometimes physical activity can be helpful, by activating our bodies in some way that allows the mechanisms of the stress cycle to close in on itself. Where our body has a way of bringing itself down, but sometimes we need to trigger that through certain activities. Grounding, breathing, things that they were talking about are ways of completing that stress cycle so that you can return to baseline. It's not easy, it's not comfortable, but that's the way that they have been existing with these different reactions that have felt really uncontrollable for a long time.
And then after that, I go hang out with friends. I go outside, touch grass. It's the touch, sight, smell, and feel that I do to kind of be present.
You figured all this stuff out on your own?
Yes.
This is amazing. Yeah, I think what's so sad about this is just how much of this should have been done for you. I think people don't realize this. The way that we manage our emotions is through other people. Mm-hmm. Even now, you're sort of like a foster kid surviving on your own. This is a situation where I think like the healthiest thing is that someone else should actually handle that emotion for you. That you shouldn't have to deal with this all on your own and cope with it.
That is one of the biggest myths, probably in American culture specifically, where we are told that we are meant to control and contain our own emotions. And what Dr. K is talking about is that we contain our emotions in community. And so with some of the decrease in direct communication, trusting relationships, loving relationships, interdependence among people, we've also kind of lost the ability to contain our emotions through a community, and we feel like we have to handle all of it ourselves, which is nice in theory, but doesn't work for a lot of people.
And that you should be able to cry and get angry and things like that, right?
Yeah.
So like what a parent does when a kid is like 3 years old and they're learning how to cry, which you haven't been able to do because of what seems like some amount of Hispanic upbringing, foster care, things like that.
Yeah. My parents didn't like me because I was gay, so they kept me away from society, kept me away from people.
Yeah.
Like they had me essentially say, you were essentially a demon, so you need to stay in this area and this is how you should act and be. You are quiet. You are
So messed up.
So that's what I've learned, and now I'm trying to readapt to it. And the biggest thing is feeling my emotions. Like this, I can control. This, like, it's so hard.
Yeah. So,
C's got a lot of experience and a lot of knowledge. And that's the big thing that I see with clients. They feel like, oh, if I can control this part should also fall in line. And that's not usually the case. But the heart Our emotions are what give energy to a lot of our thoughts. And so a lot of the trauma that they're probably experiencing is from this early upbringing of being told consistently, you are not human, you're not good enough to be around other people, you don't deserve a community, you don't deserve a loving environment and a safe spot to land. That is going to mess with how you view yourself, how you view other people, how you view the world. And the world is just generally not going to feel like a safe place.
There's a modality called EFT, which is called the emotional freedom technique. There's a lot of studies now that show that trauma is stored in the body. And I think that these reactions that you're having where you feel like your body wants to cry and your mind doesn't, like that's where like literally stuff is stored, is pent up. And I think it's got to come out. And I think the most important thing is trying to find someone who will deal with it for you, because you've dealt with it on your own for like far too long.
So what does that look like then?
It's a great question. Sometimes this can be a therapist. Sometimes it can be a friend. I think it can look a lot of different ways. Tragically, you were not given that growing up. And I think this is one of the saddest things in psychiatry, how insufficient treatment is.
Yeah, what he's talking about is both getting some support, which is just necessary, but also reauthoring in some ways their early experiences. Their parents were not safe for them to be able to cry to, where they didn't have a community, they didn't have friends. But by being able to seek help through friends now or through a therapist now, those are ways to reauthor and recognize, oh, there are some people that can be safe. And that can be a powerful exception that can disprove the general rule that C's been operating under, which is that people are not safe. I have to handle this myself. No one else is going to do this for me. No one else is going to help me. Nobody else cares about me. And that can go a long way towards helping some of these responses and these reactions be a lot less intense.
It's a substitute for love. And I think like love really goes a long way.
Yeah, and for me, it looks like actions too.
Thank you, C. We're going to pause here and switch participants.
Wow. Okay, I did not know they were going to break down into so many different conversations. I think we're probably going to get through this one claim, and then I'm going to have to do a parts 2, 3, and 4. Comment below if you'd be willing to watch parts 2, 3, and 4 as well, because this is fascinating stuff. And again, I think this is super valuable to be able to bring some of the therapeutic process out to light, both in hearing Dr. K's thought process as well as his direct interactions with these people. Admittedly, again, they're not his clients. This is not a counseling session, but he's probably fairly consistent with how he presents in a therapy session.
Before I call the next person, can we fly in maybe some tissues if people need them? Raise your hand if you need to grab a couple.
That should probably just be everyone in the circle at this point.
I brought one. I came prepared. That's okay. May need more than one.
All right. Maybe everybody just take like one cleansing breath. I know it takes energy to listen. It takes energy to share. But thanks everybody for the generosity.
I appreciate that he brought that up, because this is a profoundly uncomfortable experience, I would imagine, for most of the people in this circle. First of all, to be struggling with depression, which is already a stigmatized condition, and then to come onto a show where you know millions of people are going to be watching and potentially hearing your story, and then sharing that with somebody that you maybe know from online but you don't actually know personally, and inviting yourself to get deep with that and open and vulnerable with that. Props to all of these people who are willing to come out and share their experiences. That is not easy to do. I would be super uncomfortable in that situation. So yes, thank you to all of these people who are willing to be very open and vulnerable live on YouTube.
I'm gonna choose the next participant. Leah, I saw your flag up. You ready to go?
Hi.
I'm Leah.
Leah Alok, nice to meet you.
Nice to meet you. Well, I just wanted to, for one, say that I've related to things that both of these people have been saying before me. First, in the grief, my dad passed away 6 years ago. That has been a significant source of my depression, and I have treatment-resistant depression, but it's not for the lack of wanting to be treated. I would do anything for something that works, but like nothing has. Like it's like my mind is, I feel like, is searching for more reasons to.
Yeah, treatment-resistant depression is not a specifier within the DSM, but it's a recognized category where someone has sought treatment for depression for a very long time. And she said, I think 6 years that she's been seeking treatment, probably done some medication as well, probably tried a lot of different medications, probably struggled with a lot of side effects as she tried the different medications, and nothing seems to have worked. I don't know what the particular criteria is to label it treatment-resistant depression, but that is one of the trickiest things to see in a counseling session when somebody comes to you and they're like, all right, well, I've seen 8 different counselors. I've tried 10 different medications. I'm here because I need to be. What are you going to do that's different from everybody else? That is a challenge. And I'm curious how he addresses that.
Be depressed sometimes. And also, I relate to the dissociation. Like, half of me is like somewhere and the other half is like super depressed. So, for example, I'm a musician, and how I cope is actually writing about this really deep, dark stuff, like suicidality and stuff. I write about that. I was at a show, and the show was going objectively really well. Sorry. Yeah, I just looked out at the. Sorry, I don't even know why I'm crying right now. Objectively, everything was good. I just looked out at the crowd, and I felt so empty. So, I'm doing the thing that I love, yet I still felt, God, I feel like I've never felt more alone. Sorry, I did not expect to cry.
And we don't know what the crying's about. She's not explaining that, and that's not the point. One of the misconceptions maybe about depression is that it's not just feeling sad all the time. There can also be this profound emptiness and loneliness that she's talking about that can really suck the joy out of life, out of the things that you really love to do, like she's talking about playing music. She's playing a show. People are watching her. It sounds like people are vibing with the music, and she still feels empty and alone, even though she's surrounded by people who are on the same page with her. They are following her music.
Yeah, can I respond?
Yes, please.
So thank you so much for sharing. What was your name again?
I'm Leah.
Leah. Here's what I'm hearing. So here you are, you make music. You use it to cope.
Yeah.
But I imagine you like it too.
Yeah, of course.
Right? And you're on stage. You're actually like kind of at the height of joy and fulfillment in your life. Like this is what you came here to do.
Yeah. I mean, I'm not exactly where I want to be yet.
I'm sure that there's, stuff that can be better. But
Yeah.
if we think about, just the moments of joy and you're denied that.
Yeah, it's like things are starting for me, and
then
why am I still not?
Yeah, right. So I'm almost like thinking about how hard it must be for the things in life that are supposed to feel really good to feel so alone.
Yeah.
Right. And I really hear that you've got treatment resistant depression. And I hear that if anything could take this feeling away, right? If anything would just allow you to experience life the way that regular human beings do, which is like when I'm on stage and having a good time and everyone's singing lyrics, I should be having a good time too.
That's something that he's touching on that really highlights some of the thought process that she's going through. But the idea of should is huge when it comes to depression. I should be feeling better. I should be enjoying this. Those create kind of a standard for ourselves that takes us out of the moment and starts us examining, like, am I actually happy? Am I enjoying this? And that leads to a lot of that doubt and that emptiness, because once we start examining that and we say, oh, I should feel this level of happiness doing this thing that I love and that people are here for it, but I only feel like this, that by itself becomes very depressing.
And that feels really, really terrible.
Yeah, it
like you're
does.
being denied the chance to live an ordinary life.
Yeah, that's sort of like why it's so bad.
Yeah. So let me ask you this. How do you understand that your mind is searching for reasons to be unhappy?
Well, I'm super judgmental of myself.
Okay.
So my self-talk is like very negative. I'm sort of like at a constant like argument with myself. So it's like, but I'm also like, I know that I have to like accept these thoughts and not argue with them to get better. Like I know the solution on paper.
Yeah, you can tell she's been to therapy because she knows that answer. This is my problem with CBT, right? She knows, she's obviously done enough therapy to know that she shouldn't be feeling that way. And again, that's another should. Now there's an added layer. Okay, first it's, I should be feeling better than this. And then the second layer is, I shouldn't be thinking that because now it's making me feel worse. And so he's really highlighted that thought process and brought that to the forefront for her to talk about, with her just kind of alluding to it really. So he really caught onto that thread and pulled it out so that she can start talking about, okay, this is how I'm thinking about things. This is what my internal thought process looks like. That would be a mechanism potentially for her to be able to change some of these depressive symptoms that she's experiencing.
It's just harder to apply in practice. For example, like I'm doing what I love, right? Why is my brain, it feels like it's like looking for reasons to be upset.
So here's one of the tricky things I've learned as a psychiatrist, and I've worked a fair amount with people with treatment-resistant depression. I think there's 3 patients that I've worked with that I really have not been able to help. that I can think of, and I remember them very well, and we tried really hard, and I think I hate that. But
What do you do about something like that?
Tried all kinds of things. But I think the good news is that, for the 3 patients that I've worked with who have treatment-resistant depression, I've worked with 50 to 75, that things have worked. And the one thing that I would really tunnel down into, just because we have a little bit of time here, is to really pay attention to that part that is searching for a reason to be unhappy. So don't argue against yourself, but try shifting your attention away from that towards other things.
I've definitely tried.
And I think that's a skill.
And sometimes it works.
Yeah, so I appreciate that he's bringing up this is not just a suggestion, go and do it, but that it's a skill. I tell this to my clients all the time. Yes, we can have the knowledge of how to do something, how to cope, how to shift our focus, but then also we need to practice it in session, outside of session, so that when we're actually in crisis mode or escalating to crisis mode, we have that skill to be actually accessible to us. The other thing that I hope he develops the idea a little better when he talks about shifting his focus, I would hope that he's not talking about just avoiding those thoughts, because she's already trying to avoid those thoughts. She notices those thoughts and says, oh, those are bad thoughts. Let me get away from those. Let me think about something else. And it becomes more of an avoidance. She becomes more afraid of the idea of something leading to more depression. So I hope he develops that idea more, because right now it's hard to tell exactly what he means by that.
Right. So if it works sometimes, then that's where I think learning to be better at it can offer some relief.
It's just the fact that it always goes back.
That's where we get to part number 2, which is to understand why there's a part of your mind that is really, really unhappy with being happy. The most alone that you felt is when you are actually should be the happiest.
Yeah.
And so to really understand what is it within you that is looking for unhappiness.
We're gonna pause here. Leah, thank you. We're gonna switch participants.
All right, so like I said, this was a little bit more broken up into more participants than I expected. So I think we got through 3 people. I'll do multiple parts. Comment below and let me know if you would watch those other parts as well, because I think this is fascinating stuff, and this is part of the reason that I made this channel in the first place, so people can see what good therapy, good therapists can look like. Now, I'm not saying that he's the only ideal of a good therapist, and I had an opportunity to compare and contrast some of the things that I pick up on and some of the things that maybe he let go and some of the things that he picked up on that are like, oh, that's really good. This is just really putting therapeutic techniques and ideas on a very public stage for people to understand this is what this can look like. And I appreciate that he kind of varied his style based on what each individual person needed. For levels, he was providing that support and suggestions, direct ideas, and for C, he was very educational, talking about the background of why that trauma may have affected them the way that it had. And then with Leah really diving into her thoughts and her thought patterns and providing some tools that might be able to help her in the long run. So really cool concept. I think this is the kind of Jubilee video that I would be interested in going on. But of course, like I said, I would be super nervous going on to a show like this and putting my counseling ability on display for everybody to see. But still, very cool concept. I'm down with it, and I'm definitely going to be watching more and hope that you all want to watch along with me as well. So go ahead and comment below. Tell me what you thought about Dr. K's style, some things that you picked up on. What are some of the stories that you resonated with? So thank you so much for watching. I'll see you all next time.